Okay, so we're replacing an NG tube for suction today. So a couple of things I would want to assess before even touching my equipment is, do I have the doctor's order for low intermittent suction? If it were to be for continuous suction, I would worry because that could attach to the stomach and cause erosion. So I would check, do we have low intermittent suction order from the doctor? Yes, we do. What about the abdomen? So have they been passing gas? Do they have nausea? Is the abdomen distended? What have our bowel sounds been like? I want to look at the nares. Do we have any maybe prior surgeries, deviated septum, any blockages, any facial trauma? And also the level of consciousness. Can the patient, do they understand why they need it? The benefit it can provide? Are they on board even understanding it's going to be uncomfortable? Are they able to cooperate? So all things beforehand. So ready to go. I have all my equipment here. Which I won't go over, but I did get some tape ready. And then I'm ready to walk into the room. So knock, knock. Hi, I'm Molly, the student nurse. Can I have you state your name and date of birth? Great. So I understand you have some nausea, pressure, a lot of fullness, very uncomfortable. Yes, very uncomfortable. So the doctor has ordered a tube to help pull out some of that gastric secretion and help relieve some of that pressure. I am going to be very honest with you though, it is an uncomfortable procedure to get the tube to the stomach to help relieve that pressure, but almost kind of like vomiting, it's uncomfortable, you feel so much better after. Once that pressure is released, you will feel a lot better after that pressure is released. So although it's uncomfortable, it will help. So do you feel like, let me explain how the procedure works then. So how it works is we insert a flexible tube up the nostril. We decide which one's best. Once we reach the throat, you may gag a little, and that's okay. And then I'm gonna have you lean forward and tuck your chin to your chest, and I'm gonna hand you a cup of water with a straw and say, drink, 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 swallow, swallow, swallow. And as you do it, I'll advance the tube. At that point, your body the instinct is to pull away, maybe gag, and that's okay, we can take a little break, but the sooner we get that tube down, the better. So I just wanna make sure you understand what we need to do to get to the tube to the top of the stomach to help you. Do you think that'll work? Sound okay? Great. And then I also wanna know, it can irritate the nose, but we can give Vaseline and make sure it's secured well to help, and it will feel uncomfortable in the throat because it is a foreign body. Your throat's not gonna want it there, but it is temporary. This is only for a short amount of time, and we do have ice chips, lozenges, and spray to help with the throat. See, that sound good? Ready to get started? Okay, so let's get you feeling better. So, all right, so do you have any history of deviated septum or surgeries on the nose, sinuses, anything? No? Any recent colds? No. Okay, so now you tilt your head back. And I'm actually gonna look in the nostril and look for any abrasions, occlusions, swelling. They both look clear and good to me. Breathing sounds good. So I'm gonna actually plug a nostril and have you breathe. Okay, and other one. They both sound really good. Is there one that had better airflow to you? Okay, so we'll do that, not a problem. So then we're going to measure with a tape measure for our tubing. So we go from the tip of the nose to the earlobe, excuse my reach, and then down to the xiphoid process, which is around the diaphragm here. Okay, so I'm at about 51. So let's get our tube ready. So this is called the Salem pump. So what we want to do is place tape at the 51 mark. Here, 51. I have tape ready. Okay, and then I'm going to attach the end of the tube to a syringe. All right. So I'm going to lubricate the tip of the syringe. We would use water-soluble lubricant, but I'm using dish soap and water for the mannequin. So I'm gonna have you tilt your head back, and I'm going to gently insert along the floor of the nostril towards the ear. And when when it gets to the throat, we'll stop. Okay, maybe if you're gaining, I'll give you a second here. So I'm gonna have you tilt your head forward, chin to chest as best as we can with a mannequin. And our water. And I'm going to, as you're leaning forward, chin to chest, gonna say drink, 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 swallow, swallow, swallow. And I'm advancing about 2 to 4 inches for each swallow until we get to that tape. And if you were to have resistance, you could pull out and try the other nostril. If you were to have resistance and that maybe it's coiled in the throat, all things we can check. Good. Yeah, and as they're doing this, they're uncomfortable. She's saying, we're almost there. And making sure they're cooperating. So very good. Get your head back up. And okay, so we talked about that. So I'm actually going to visualize and look at the throat, and I see it going down, which is good. So before I secure it, I'm gonna aspirate. I want dark green liquid, and I'm gonna test the pH. We'd want it to be 1 to 4.5 because stomach contents are acidic, and that would be acidic. So I had a patient with this, and the gastric contents kind of leak out. So we can use this plug here to avoid making a mess. And also, just one more thing on the side here, if a patient wanted to ambulate, we can loop it like that so they can move around without spilling gastric juices all over. So I'm actually just going to do that for a second here. I would put the contents in a basin and take a pH strip. We're going to test the pH, like I said, 1 to 4.5 because stomach contents are acidic. We dip that and compare it. I'd want to say 1 to 4.5, say it's good. So another thing we can do then to check placement is to insert air and listen for a whoosh in the abdomen. So I'm going to withdraw about 10 to 30 mils of air. So I'm going to go to 25. Let's get that off. And then I'm going to have my stethoscope ready here. On the abdomen, and I'm gonna use this hand. Listen for a whoosh. I hear that without even the stethoscope, so we're good. So if you were not to hear the whoosh or have the green gastric secretion, we could advance 2 more inches and try again. Okay, so because I did have the pH I wanted, the secretion was green, I did hear the whoosh, I'm gonna connect it to intermittent suction. Our gold standard for placement is x-ray placement though. So let's go ahead. Okay, so it is attached. I would turn it on, it would be on the wall, I would turn it on, make sure I check my patency, is it everything working, secure, is the suction working? Now we're ready to secure the tube. So if the patient were to have oily skin, we could use alcohol pads to scrub it really well first, maybe some skin prep. So let's go ahead and attach it. I know my patient in the past that had this at last clinical, it came loose quite a bit. So as part of my morning environmental check, I would just get him brand new secure tape and just set him up for the day for success and talk about not tugging on it, etc. Okay, and then we attach it to their gown. This patient doesn't have a gown, so I'm actually just going to use tape, but we would use a safety pin to attach to the gown, allowing room for them to move their head back and forth, up and down. That should be good. Talk with the patient of measures we can take to help with the irritation of the nose. Like I said, Vaseline, and we're checking the nose every day. We don't want it to be red, too red or inflamed or painful or infection. And talk about this piggy tail here. Nothing goes in the piggy tail. And we keep the valve attached here to help maintain air pressure. So we're attached to suction. I believe all that's left to do is we want to document. So we document which nair we used, how is the nair looking, any problems, how did the patient handle it, how are they feeling now, what's our color, color, amount, character, and amount. So like I said, dark green's good. Probably have a lot come out at once. And I believe that is it. Yeah. And that should be it.